Hello, I'm Dr. Jeffrey Niezgoda, AZH Wound Care Center in Milwaukee. Welcome to another edition of the Wound Care Window. Many times we are confronted with patients with pressure ulcers over the calcaneal or heel region of the foot. Many times these are dry, and the question often is to debride or not to debride. We've got a patient that I would like to illustrate some of the decision making related to calcaneal pressure ulcers with dry eschar. This one here is dry and intact. You'll note that there's no evidence of erythema, there's no fluctuance, there's no fever, increased warmth or tenderness that would suggest a process underneath this eschar of an infectious nature. This is an excellent biological dressing, and based on this examination, this should not be removed. So what we want to do is allow this to heal on its own over time. And when this happens, the edges will start to separate. You'll see we're getting a very little bit of separation, but certainly nothing that would catch during a dressing change or while the patient is being moved in bed. So this should be maintained intact. On this side, we see a very similar presentation. The eschar is dry and intact. There is no evidence of erythema, warmth, redness, or any other evidence of infection. However, what we are noticing on this side is that the ulcer is starting to heal, the eschar is starting to separate, and you'll see these margins of tissue starting to rise here. This could easily catch on the sheets or the blankets or dressing and could be pulled off, which would be troublesome for the patient, could cause pain and bleeding. So what we want to do is we want to start to trim these margins back so that we have an interface of the eschar on the wound that cannot be disrupted by trauma. And again, this is evidence of an eschar that is healing and is appropriate to start debriding. But again, unless this tells us that it's ready to come off, we'll also leave this intact. So let's demonstrate that debridement right now. Debridement of these eschars can be done in a number of ways. Typically we'll take scissors or curette, and we'll just come in at the margins and just take that edge down. Gentle traction will enhance the separation, and then we're going to debride right where that eschar sort of meets the healthy tissue underneath. You see that we've now created an eschar that's very similar to the other side, and that it will not be traumatized. Here I'm using a sharp curette, and I'll gently pull that eschar away and remove that margin. So a combination of scissors and curette are often helpful for these. You'll notice that I am not going to debride the entire eschar. Again, this is still serving as a very nice biological dressing and will protect the tissue underneath. All we're really doing is we're encouraging the separation of the eschar from the underlying tissue by removing the margins. What you'll notice is the tissue is very healthy right underneath that margin. That's what we want to see. That healthy tissue is what is allowing this eschar to separate slowly. And it speaks to several things. It speaks to the overall status of the patient. Obviously that's improving. This would not be separating if the patient was not slowly improving from an overall standpoint. It also speaks to the fact that there is no ongoing pressure. This patient is having very excellent pressure redistribution and management of his ongoing pressure. As you'll note, we see no progression of the pressure change anywhere outside of the wound. This is intact. Again, no evidence of infection, a stable eschar. This should be continued to be managed in a closed fashion. On the next visit, we will evaluate. I suspect that the eschar margins will continue to separate and will again be debrided at the next visit.